is I like to bring in any paperwork that I can find. Usually we have a pack from the hospital, and I just engage the patient in the evaluation as much as I can, pretty much the entire time. So if I'm going over their medical history, I'm assessing, how aware are they of what happened in the hospital? How aware are they of their medical complexities, their diagnoses? There's a medication section. We discuss their medications. I'm assessing their insight, their memory of, the medications they're on, their new ones. So I'm just involving them throughout the whole evaluation process so I can do point of service documentation. There's definitely sections that I can't, and I just save that for a little bit later in the day, but I would say for the most part, I'm able to involve them in most documentation for evaluation.
Yeah, I think that a challenge with point of service documentation is that there's a computer there in front of you and the patient, and that can sometimes make it less personal. So I really try to address it with my patients, like when I'm first meeting them. Hey, we are going to be inputting all your information into the computer, into your medical files, so that I can refer back to it, other clinicians can refer back to it, and really make it the driving force of their plan of care. So this is what we want to do to get you home as quickly and as safely as possible. I like to ask a lot of open-ended questions so that while my patient's talking, I can actually be typing into the computer. And I feel like then you get a lot more background on patients too. Just the open-ended questions, sometimes you'll find out things that you didn't know about them, like, oh, I actually have had some falls, or oh, I actually did injure my knee 10 years ago, and maybe this is why I'm having an issue. I also really try to make it about the patient. So what do you want to work on in therapy? And just verbatim write out like what their goals are and what's important to them, and kind of make it so that they feel like they're the driving force of their plan of care. I really try to do that with the follow-up notes as well. So this is what I'm seeing. I feel like your strength's improving. Do you feel like you're making any gains? Like, how do you feel like you're doing with your therapy? What are we working on that maybe you're not interested in, or what are we not working on that's really important to you that maybe we can make some goals for and address during your therapy sessions?
For evaluations, I like to get the patient involved in their care. The number one complaint that I have on our patient satisfaction surveys is that they don't feel that they are involved in planning their goals and their plan of care. So it's a perfect time to hit point of service documentation with those evals that are challenging, to sit down with the patient and go through the goals so that they feel involved and that they know what their plan is.
So at our facility, we have anywhere from 1 admissions all the way up to 12 to 15 admissions a day. So it can go from easy to hard really quickly. One of the bigger things that we do is have our therapists structured. So we have a 12-hour working therapy gym where right when the patient comes in, we're evaluating them, but not only evaluating them, but providing the therapist with treatment time from day one, so they get started right away. We also do point of care service, so the documentation is completed on the iPad at evaluation and discharge with the patient there, which allows them to decrease the non-productive time because they don't have to copy it on paper and onto the computer system, so they're able to do it right there. It also allows the patient to be engaged in the goal writing because it's completed right there with them. They are part of the evaluation, which is a requirement. It allows them to be there and incorporate their hobbies, their activities, and what really they're going to return home to doing.
That is so true. With the point of service documentation, you're able to really get a real good history, and it's so much more accurate and engaging the patient in their actual care. Like, what's their goal? Where do they want to be in 2 weeks? And so, like she said, is we allow evaluation time built in right away, as well as treatment time. So they're able to just get started, get focused, get the patient engaged in therapy, and let them know what their plan is. And so that's exactly right.
Similar in our facility, our number one complaint from a patient is that they don't feel that their goals are discussed with them, and they don't understand their plan of care. So having them involved right from the beginning with their evaluation, let's find out what their goals are, because they may be different than ours, but their goals are ultimately what we need to reach for.